going to be your MC tonight. Thank you so much for joining us at the Summer Speaker Series here at 5G Hub. I am very excited to talk tonight about healthcare. It's a vertical that's pretty close to my heart. We've got 4 fantastic speakers tonight, but to get us in the right headspace, as we always do, we're going to start with a little bit of trivia. So, rules for trivia, we're going to put some questions up on the screen. Raise your hand. I'll call on you. If you get the answer right, Hannah, here somewhere in the crowd, is going to find you. She's back there. Hi, Hannah. And she's going to give you a swag bag. So if you get the answer right, keep your hand raised, because that's how she knows to find you. If you don't raise your hand, she might give it to some unsuspecting person. If you get it wrong, we've got to move on to the next one. So let's go ahead and get started with our first question. In theory. There we go. I'm not going to read it because you can clearly see it, but the first hand I see shoot up, I'm going to ask the question of. Who thinks they can answer it? There's a hand. C. C. All right, let's see C on the board, no pun intended. Well done, sir. Keep your hand raised. Hannah's going to come find you. Brilliant. Moving on to our next question. Insider Intelligence calculates a $93.9 billion in cost savings worldwide by 2030 due to the implementation of 5G. Which use case promises to deliver the highest cost savings by 2030? I see a hand back there, sir. B. Let's see it on the board. Ooh. We need a sound effect for that. Next one. The AMA reported that increasing utilization and supply costs are adding financial pressures to already strained post-pandemic health systems. What was the % increase in US health expenditures from 2019 to 2022? Geez, trillion's a big word. D? Brilliant. Let's see. Ooh! I hear some people saying the answers out loud. You're just giving your hints away. Raise your hand. Raise your hand. Next one. According to the Health Information Management Systems Society, HIMSS, clinicians and patients are experiencing a confluence of technology changes all at once. Healthcare providers are continuing to invest in technology expansion. What are the most common digital healthcare use cases expected to be prioritized by health providers? I see a hand way in the back there. You on B? D, as in dog? Let's see D. E, all of the above. Clearly, we need to do some educating on healthcare. That's why we're here tonight. Last opportunity for swag. Hannah's getting antsy in the back. Which of the below is a true statement? I saw your hand up go first. D, all of the above. Ooh, so close. That said, Hannah, can we please bring a swag bag to our guest at the front? Keep your hand raised, please. Brilliant. Okay. Well, hopefully we're feeling primed for tonight's topic. It's a big one. I saw some scary words up there like trillion. Healthcare is a big deal. So let's start getting into it. Before we do, a couple points of order. One, if you have any questions for our panelists tonight, they're going to give some presentations. You can submit your questions. If you're here in the audience, you'll see a QR code on either side of the stage. If you scan that, it'll pull up a form online, fill out that form. That's how you submit your question. Same to those who are watching at home. You should see a little QR code on the bug on your TV right now. Scan that and submit your question via the same form. That's how our panelists are going to know what your questions are. There's some amazing demos in the back of the room. I haven't seen them yet, so that's where you're going to find me after the show. Please go give them a look. And one more point of order. I'd like to invite onto the stage my colleague, Tex, who's going to tell us a little bit about the program that we have here at 5G Hub. Tex.
Hello. Welcome.
How's it going, sir? Tex, help contextualize. Where are we tonight?
Well, we're at the 5G Hub, which is kind of the center for innovation. Pretty much any technology from T-Mobile and more, you'll find it in this place.
Brilliant. And we've got like tons of radios on the walls. We've got a CNC machine in the back. Like there's a ton of stuff here. Like what do people come here to do?
Well, it really varies from companies coming here and starting off from here and building their products from scratch and using the different technologies. There's others that come here, they want to connect 5G or test it over 5G. So proof of concepts, technology evaluations, really depends on what you're building and what you're trying to accomplish. Obviously using the T-Mobile technology. All the infrastructure, and the good thing is we've got experts just across the road. So if we get stuck for whatever reason, we can just make a call, bring them over, and kind of help the company get unstuck.
Awesome. And if someone wants to get started, how do they go about doing that? How do they reach out to us?
Great question. So one of the ways you can get started, and the easiest way, probably going to our website, techexperience.com. Over there, you can see all the information. You can see some of the stories from the projects that have taken place here, including, there's an option for you to click on a button to submit your request. Somebody will then look at their request and have a follow-up. As part of that, if those that don't get accepted, or if you're using the T-Mobile technology, obviously, then we'll come in and have a project that run here by one of the project managers. And once all said and done, then there's different opportunities to go from there, whether you want to partner with T-Mobile or not, is your product at the end of the day, right? So website is usually the easiest way to get started.
Awesome.
That said, before I go, we're going to be around for answer any more questions. And so right at the back, once the show is done, for lack of a better term, you can come and ask further questions if you've got any questions. All right. Thank you, guys. Thank you all.
Fantastic. Thank you, Tex. And before we get started, I'd like to invite one more person onto stage, our Senior Vice President of Systems Realization, Grant Castle.
Great, thank you. Hello to everyone. I've met some of you, certainly not all of you. Just want to introduce myself. I've actually been here at T-Mobile quite a long time, and I actually worked closely with Aaron building this a few years back. I'm recently taking over again to help out with this team, which I'm really excited about. So I just wanted to kind of say hi to everybody, and also wish Aaron a lot of luck. She's done a bunch of great stuff on these, and I'm looking forward to this one as well. So I'm going to leave it to her and the rest of the team to go, but I just want to say hi and welcome. Thanks.
Thank you, Grant. Glad to be back in the fold. Okay, on to tonight's actual topic of the presentation, healthcare. It's a topic that is very close to my heart because it's a common point of conversation at our home. My wife just started her intern year at her medical residency at Northwestern Hospital in Chicago. And she'll come home and we'll talk about her shift, and half of my brain is there just to listen to her talk. How did your shift go? What were your highs? What were your lows? What were your challenges? What are your hopes for your future and the future of medicine? And the other half of my brain is going, challenges? Oh, you mean pain points? You mean pain points that maybe technology can solve for, which brings us why we're here tonight. We've got a room full of technologists. And I want to know, if we all start thinking about these problems, what can we do to come up with the solutions in the future that are going to help patients, providers, and people like my wife to stay out of the mundane and focused on the medicine. So, without further ado, let's start to hear from our speakers. Our first speaker tonight is one of our own. His name is Tarun Sheshraj, and he is a sales leader and head of T-Mobile's Strategic Healthcare and Financial Services vertical. He's coming hot off of 2 decades, not years, at Vodafone, and the whole time he's been asking, how can we transform industries using the power of 5G technology to drive innovation, enhance efficiency, and deliver value? So please join me in giving a warm welcome for Tarun.
So before I start, a quick question. How many of you here feel healthcare is complex? Right. All right, one more question. How many of you feel healthcare is expensive? Right. I've never walked into a room where people have disagreed on these two questions, right? I think we can all agree that healthcare is an emotive subject and it's a personal topic. Now, every one of us in this room has had an experience with either a loved one, a family member actually, right, or a friend where the care experience was suboptimal. Now, this is also an industry that truly changes lives. But when we talk about healthcare, actually, right, it's truly large. It represents nearly 17% of the US GDP. But in a recent Gallup poll, when they surveyed, they found nearly 52% of all Americans were dissatisfied with the quality of care they were receiving. And on top of that, a staggering 76% said the cost of healthcare was too high. Now, today I want to talk a little bit about the trends that we are facing in the healthcare provider space, and hopefully how technology can make a difference, especially when it comes to 5G, right? So there is no beating around the bush, actually, right? Healthcare providers face a very complex environment, and I want to talk a little bit about the complex market forces that are forcing them to adapt and change. First off, is workforce stability. I think COVID-19 unleashed waves after waves of challenges and burnout for most healthcare professionals. Nearly a half of them are planning to leave the workforce. By the end of next year, there is going to be a shortage of 450,000 registered bedside nurses, which is huge. Now, this has a large impact on the knowledge retention and management. Think of, hiring new people and the cost of retraining it. And when you start compounding that with the competition that you're facing with staffing and contracting agencies, suddenly you realize that the cost of workforce management is a big challenge that most of them are facing. I want to quickly talk about the financial and security challenges, which, again, is a big topic. Now, when you look at healthcare, the big headline numbers are Kaiser Permanente, 100 billion in revenue. NHC at 65 billion. But by and large, the typical healthcare provider is really pressed for margins. And compounded by this, many of them have had security challenges just this year alone. Change Healthcare earlier in the year was hacked and user data was stolen. Right in Seattle, Providence had 15,000 servers which went down during a recent CrowdStrike outage. And lastly, if I talk about Ascension Health System, they've had an outage, again by hackers, which took down all of their electronic communications. Now, this is just an example of the 3 largest healthcare providers in the US, and you can just imagine what is happening for the rest of them. Now, moving on, we also see a big trend in what is called value-based care, which is the new paradigm for healthcare providers. In fact, under this model, healthcare providers are reimbursed based on the quality of care they provide rather than the number of services they perform. So the whole idea is that healthcare providers now have to focus on care coordination, better patient outcomes, and population health management, which leads to overall care quality and reducing the cost of healthcare. The problem with this, it also increases the risk-reward profile for most of the healthcare agencies, and they have to invest first before they can see any ROI. Now, add to this the fact that most hospitals out here, which I'm sure you'll agree, have aging infrastructure, which all needs to be upgraded, right? So just to bring back some of these points, all of these add a lot of fiscal strain on the traditional healthcare system. Another large challenge that we are seeing, but it's also an opportunity, is competition. Now, telehealth has taken off after COVID and has become a very acceptable business model. But it also means that there are a lot of non-traditional players entering the healthcare market. For example, consumer electronics giant Best Buy is now investing in healthcare companies and sending its team members to patients' home to set up equipments for hospitals and health systems. Lyft is now actually offering rides for patients for their medical appointments. Now, these are just 2 examples of non-traditional players entering into this space, and there's going to be more of them trying to disrupt. The third interesting trend that you're seeing is rural America, right? Now, only 20% of the US population resides in rural America, but nearly 80% of that population is considered as medically underserved. This is a big challenge, but also an opportunity. And the last one that I want to talk about is consumerism. Now, I think patients have become far more demanding. They want healthcare when and where, as opposed to just going to a traditional brick and mortar facility. And that trend is going to continue, where remote patient monitoring, at-home healthcare, these are all very prevalent models that will continue to stay. So I've talked about the challenges that you face at a macro level, but I do want to also talk a little bit about what clinicians face in a traditional hospital or a healthcare provider setting. In the previous slide, we spoke about all of the challenges that healthcare providers face, but one of the big things is about reducing the clinical workflow challenges. Now, today on an average, a nurse spends 25% of their task on administrative and regulatory related work, time that could actually have been spent on direct patient health. The current model is to move carts, spend too much time filling up data at one location. And if you move around too much, the Wi-Fi tends to become spotty. Secondly, the devices have proliferated in a hospital environment, right from barcode scanners at pharmacies, you're talking about clinician tablets, or even industrial IoT devices. The number of devices have started putting a strain on the traditional Wi-Fi environment. And 5G actually can address those problems in making connectivity secure and ubiquitous, and often it can also act as a parallel network to Wi-Fi. It can enable also low latency use cases, especially those on the edge. And if you've been reading the news, Gen AI is a major use case which is taking off in a big way for most healthcare organizations. My belief is in the future, 5G is going to become a seamless platform for connectivity. Now, imagine a patient who's been given a wearable within a hospital, and the wearable works very well within the hospital, but the same patient, when he goes outside, he should get seamless connectivity, which traditional Wi-Fi is unreliable at the moment. In the case of 5G as a platform, whether it's a private or a hybrid 5G within the hospital setting, or whether he's traveling to a public 5G outside or at home, he gets a seamless experience. Now, ultimately, all that physicians care about is the device going to work, and how can I actually spend more time with my patients? Now, I also want to quickly talk about one incident that happened with a large payer recently. This payer is a very large Californian one, and they work with Medicaid to provide outcomes for seniors in care homes. And the whole plan that I was trying to work with them was for wearables to track vitals for senior people. After several conversations, we quickly realized that this conversation was not going to take off. And the reason for that was the care homes did not have the infrastructure to even support traditional cellular. In fact, some of them were set in the 1980s, actually. Right? Now, think about VHS in the living rooms. The reason I'm trying to make this point is traditional hospitals were not built keeping in mind the latest connectivity trends. There are a number of challenges that hospitals face, and some of them are about the building materials, actually, right? Many of them are obviously built with concrete and steel and low emissivity glass, which causes interference with wireless signals, and sometimes it's very difficult to maintain a strong and reliable connection. Next, hospitals are densely packed with medical equipment. Electronic communication leads to a lot of interference, and that creates a lot of congestion on your wireless networks. Thirdly, I think everybody can attest that you walk into a hospital, it is a complex maze, actually, right? You have wings, you've got buildings, and it makes it very difficult for traditional Wi-Fi to give a seamless coverage throughout the hospital. And lastly, I made the point earlier about the number of devices which are right there in the hospital nowadays. Even as a patient, you're all hooked to your traditional phones or a tablet device. All of this places a lot of demand on your traditional traffic. On the right side, you have a stat out here, actually, right, which is shocking when you think of it, that nearly 45% of all connections that are made on Wi-Fi, whether it be an app or whether it be a call, on the first attempt drop, which probably talks about how hospitals and Wi-Fi coexist. And the whole idea is that if you're sitting stationary at one place and working on a Wi-Fi, it's perfect. But it's not so great when you're talking about mobile use cases. And the whole idea that you have clinicians moving around with carts wherever they go and then trying to fill data all the time, that actually is leading to a lot of burnout. I just want to quickly talk about how 5G can actually hold promise in the space of healthcare. Now, I earlier talked about how Gen AI is taking over in healthcare. Just as an example, actually, right, Kaiser Permanente has recently rolled out an AI-powered note-taking app, and now it's applicable for nearly 24,000 doctors across its system. You can imagine the power of an app which needs ubiquitous coverage all of the time, and it picks up ambient noise, real-time communication, even while you're traveling. Another national hospital group has rolled out a virtual nurse, and this is essentially a tablet which is powered with a chat GPT-like functionality, and it provides the bedside nurse all the data about the patient, and they can have a live conversation with the tablet to understand and provide better outcomes to the patient. Now, these are two such use cases which can really harness the power of 5G. And there are a few more, actually, right, which you can see on the screen. For example, digital electronic health records, right? It enables healthcare workers to be always connected to real-time patient data and health records no matter wherever they are. Ultimately, it's all about finding the right use case and making sure that this fits within the confines of a hospital. I would make the point that all 5G systems are not built the same way, and selecting the right 5G provider is important. And I just want to roughly talk about a few criterion for selection. The first one obviously tends to be the network coverage, but it's also about the spectrum and how the architecture is built. So this was a quote that, I'm leaving everyone with this particular one, but thank you for the time today. Cheers. Yes.
Thank you very much.
Thank you.
Tarun mentioned a modern application, listening to clinician-patient interactions. We've actually got a demo about that in the back. I would love if you guys went and checked out. Anyway, let's keep the conversation rolling. Our next speaker is Michael Feld, the co-founder of Pixel Health. Now, Michael has 2 decades of experience at the forefront of telecommunications and IT consulting. He's held pivotal roles in leadership, including interim CTO at University of Chicago Medicine and former CTO at Temple University Health System. In his time and capacity in those roles, he's driven the adoption of cutting-edge technology, enhancing operational efficiency, and transforming health infrastructure. So please, give it up for Michael.
Thank you. Thank you. So Pixel is all about affecting positive change in healthcare. And we do this in 2 primary ways. And I'm going to go through a number of these slides relatively quickly and focus on the very last slide, which is actually a condensed version of what we did at one of our clients, Boston Children's, which I think is the harbinger. It's the example where I think a lot of healthcare is going to move, especially with mobile technologies. A little bit about Pixel first. We started well before healthcare. We were in the carrier space, so connectivity, interconnections, stability of how to drive all those systems, that's in our DNA. We fell into healthcare by accident. A carrier that we were supporting sent us to a hospital to help solve a local problem. We did, and then we fell in love with healthcare. So that's kind of our history. We moved from the telco space into hospital technology. Now, okay. We at Pixel view 2 mechanisms for driving change in healthcare. It's not technological. Hospitals have tons of technology. They actually have a fair amount of money to do what they want. You hear a lot about hospitals struggling financially, and while that's somewhat true, the reality is they have enough funds if they allocate them properly. And there are 2 levers that we deal with. One is the clinical experience of the clinicians, and the other is obviously the patient experience. In these 2 levers, communications and connectivity play a central part. So, for example, you see on the screen, these are major topics that our company addresses. We work with hospitals to develop their plans, implement their systems, support them in terms of operations, and things like virtual nursing, clinical communication collaboration, video consulting, location services, RTLS, things like that, are central to us. If you link all this together and you make it seamless, and interestingly enough, most of the equipment, systems, software exists to do that. What stops it is a lack of proper integration and issues around workflows. Workflows are central to what Pixel does. Workflows, for those who are maybe not in healthcare, these are the playbooks on how to deal with a specific situation. When a particular disease or a condition arises, there's a series of steps and interactions that all link technology, people in a stream to a positive outcome. That isn't always optimal, and it isn't always designed properly, and that's really the focus of what we do. The patient side of the equation is this is the other lever that we do. Many times these hospitals, and I'm sure as you guys who have used hospitals have seen that the systems of how you interact as a patient are somewhat inadequate. They're not like what you might experience with Amazon or other interactions with the public. Many of the purchasing, the interactions with companies for delivery, for services that you have outside of healthcare are very well developed. We need to bring those into healthcare. So in this case, here are some examples of the personal experience of a patient. So we as a company, we focus on not just the hospital's interaction with the patient while they're there, but other elements outside the hospital, things like food security, things like travel. Patients have a lot of trouble getting to the hospital. They have a lot of trouble financially and otherwise outside the hospital, which in turn affects their experience. So some clinical systems can reach out into municipal platforms and to other organizations, and the sum total of how those all communicate and share information directly affects a patient's experience within healthcare. The key to all of this, all of these bits and pieces, whether it's the clinicians inside the buildings talking to each other and systems, or the patients when they're in the hospitals and outside afterwards, discharge, things like that, all of this it centers on unconditional connectivity. That's sort of our word for it. The critical issue is that devices, patients, and systems must communicate inside a building precisely, outside a building precisely the way you do inside a building. There should be no barriers. Now, until very recently, this was virtually impossible. I'm assuming, kind of with a hand show, how many people are sort of technologists and technology focused in this audience? Great. So if I geek out, I'm not gonna leave anybody behind. Okay, good. Traditionally, many of our clients, when they have their internal systems wired and wireless, they control it all. They can control the quality, in theory, the security, the performance, and everything. When they start to go outside their institutions, things like the uncertainty of the internet, the Wi-Fi condition at someone's home, all of these variables make the continuation of care beyond the hospital much more difficult. And until fairly recently, with 5G and private 5G technologies, there wasn't a way to smoothly transition the networks in the hospitals outside without any really complicated software or hardware. And more importantly, if you can extend the hospital's communication platforms to a home, to a school, to a business, you could provide, in theory, the same care in the hospital at those remote locations. So eliminating geographic barriers is a critical element in providing proper health care, okay? And that's what we call this. Let me move on here. Okay. So if you have connectivity within a hospital, we call it spaces that care. All of the devices in this image all need to communicate with each other. They also have to communicate with personal devices that clinicians carry. And many of the systems in the hospital, Wi-Fi, some of the specialized linkages between applications, aren't really optimized to this. Much of that comes back to workflow and how you interlink all these applications. But all of that expects a certain level of connectivity below it. One of the biggest problems that occurs in our clients, and we have, for example, about 100 hospitals that we support, and they range, some of them are very well known, like Boston Children's or Intermountain or Cleveland Clinic or Temple University Health System, Chicago Medicine, a whole bunch of them. Many of these institutions have the same basic elements and problems in their internal communications. Systems don't work in real time. Devices drop calls. When an alert happens on some machine, it doesn't always get to the right person at the right time, and that could be a critical issue. So as the devices that connect to the patient and interact with all the systems get more, they just proliferate. The need for that connectivity, assurance of connection, security, performance, all of that is critical. At home, it will become the same way. Right now, it's pretty straightforward. There's telepresence and video conferencing. But there's going to come a time fairly soon where devices will, your Apple Watch, but also more medically purposed devices, glucometers, even intensive care. There are some of our clients that are trying to move their hospital beds, if you will, into the home, because if they can provide health care to the home, the patient will do better. They'll be more comfortable. But to do that, they have to bring all their systems, if you will, connectivity-wise, to the home. So the complexity of the rooms and the environments inside the hospitals will affect and essentially be matched by growing complexity in the home. Okay. So this is kind of where I'm gonna move over this a little bit quicker and focus on this slide. So what we built for Boston Children's with T-Mobile's help. Now I do want to stop for a minute and kind of explain the difference between T-Mobile and some of the other carriers, because we went to Verizon, we went to AT&T, and we requested of these carriers that they design a system that allows all the same platforms to work inside the building, like I said, all the stuff on the outside. And there could be no real difference in terms of quality of the signal, capacity of the signal, dependability and performance. All of those issues had to be the same. For those of you who are familiar with networking, many hospitals that have outlying clinics and wanted to go to the home are familiar with technologies like MPLS. It's a way to deploy very stable networking inside a building across to many other buildings. Such a system didn't really exist. It was the internet or something like MPLS, and no one can put MPLS into a house. So T-Mobile was the only carrier that basically carved out a little piece of its network and gave it to our client. And that's what we're showing here. So imagine for a minute, the bottom little tower, that's Boston Children's. And Boston Children's, there are phones, in this case iPhones, and these phones have a SIM in them that has the private network of the hospital. This private network is advertised everywhere T-Mobile goes. So if in theory I'm in New York City, and I want to see a particular trace, or I want to see an image, or I want to have a three-way call with some doctors and nurses on a hall in Boston Children's, I can do so with the same level of assurity, capability, as if I was in the hospital. And that's a pretty unique thing that T-Mobile did. So in this case, what the other towers, these represent arbitrary locations, and you'll notice there are these things called APNs. These are the networks that the carrier broadcasts. What I call 82 is the standard. When you buy a phone, you get access to T-Mobile's network. If it's not a voice call, it puts you into the internet. What we did is we inserted this APN 12 in there, which is Boston Children's private network. Now they can move any system internally, externally. And that basically is the foundation now of this ubiquitous, always on, everywhere present network. If T-Mobile has coverage in a particular location, Boston Children's can provide activities and support healthcare operations in that location. We're currently working with another couple dozen of hospitals that are looking to implement this. The main focus with a lot of these hospitals is, like I said earlier, remote care. How do we bring the performance, the experience of proper healthcare to the patient in their home? That's the center of what Pixel Health does. Thank you very much.
Thank you so much. Something about the idea of unconditional connectivity really resonates with me. Thank you for saying that.
No problem.
I'm going to use that.
Thank you.
All right. Well, we've officially gone through, I believe, let's get through this, half of our speakers. And I want to remind you guys about what you should do if you want to submit a question. If you've heard something that you want to learn a little bit more about, if you're here in person, you can scan the QR code on either the left or right side of the stage, submit your question via the form there. If you're watching at home, you should have a QR code on your screen about right now that will take you to that exact same form. Please submit a question. All right. Our next speaker, Scott Beck. I'm kind of struggling with a way to introduce him, or like, what do I call him? Because if you look at his 35-year career, he's done it all. From lieutenant firefighter and paramedic and nurse in emergency and clinical contexts. He's got all sorts of certifications and awards. And now he's senior VP at Saba Healthcare, where he's working on developing advances in telemedicine. And the whole time, he's been using his roots as a clinician to help small and large health organizations develop their strategies and commercial divisions across varying ranges of technology and healthcare. His approach to leadership has always blended hands-on coaching with a relentless drive to forge new partnerships and innovate. So please, welcome, Scott.
Thank you.
Absolutely.
You got it right. Good afternoon, everybody. Or on East Coast time, good evening. First, before I get started and talk a little bit about Saba, can I see by a show of hands who has used telehealth in the past? Pretty much 2/3 of the room. And those that haven't is maybe because you just haven't had the opportunity to, right? Telehealth is becoming something special. Telehealth is taking over. What really brought us to that? Well, that's what I'm going to talk about in a little story. When COVID started, that's where telehealth was exacerbated, or sorry, I won't use that word, was brought to the forefront. I'm going to tell you a little bit about Saba, and then I'm going to talk about how we interact with T-Mobile and our partnership and our relationship that we came up with a use case that had not been thought of before. So stay in by and enjoy the ride. So Saba, we're on a mission to build and revolutionize delivery of care via intelligent integrated telehealth. What does that really mean? We are an enterprise-wide telehealth connectivity platform that also is able to provide the specialized service, i.e. physicians, to go along with it. I'll give you a little history about Saba. Founded in 2016 as a tele-ICU company. We are an international company. It was founded at the heart of our mission, I guess is the best way to say it. We want to be pioneers. We want seamless, scalable, patient-centric, intelligent, and integrated telehealth solutions across the continuum, not only in a hospital, but as you'll see later on, in the back of an ambulance, or maybe at a doctor's office, or as Michael was just talking about, at a patient's home. There's multiple use cases for telehealth, and where Saba comes in and where the partnership with T-Mobile comes in is a multitude of those. Let me tell you a little bit about Saba. So we're an international company, like I said, 4,000 beds, 10 specialties. We average 3,000 consults through our platform per month. It's not a small number when it comes to that. We're in the US, we're in 15 states and 46 hospitals. And globally, we're in 40 hospitals. In fact, our tele-ICU platform is in the largest ICU hospital in all of Europe. Just to give you a little bit of background. We do medical device integration, so we've integrated, and you'll see one of our devices here shortly, that takes the data from a multitude of different types of medical devices, whether it be a ventilator, a pump, CPAP, BiPAP, an incubator. It takes that data, it aggregates that data, converts it, and then is able to push that data into the patient's EMR. It's pretty interesting, right? There's no more of all these wires and all this connectivity challenge that exists with multiple integrations. The device that I'll show you here shortly actually takes and has over 1,000 drivers and devices already preloaded in that box. So the ability to do that makes it very simple and very scalable. Moving along. So innovation is kind of what I talked about a little bit before, but it's always at the forefront for us at SEBA. We really think about the way care is delivered, and we wanted to revolutionize it. And as you heard, I've been doing this a long time, and the alphabet soup at the back of my name means nothing if we can't improve outcomes. And that's what it's about for me, and that's what it's about for SEBA. We want to improve outcomes. How does that come? By reducing length of stay, by making sure patients are compliant on medication, by making sure we're reducing admissions. All of these things that will take and create a healthier, more enjoyable life for patients. It's providing access to care at a more rapid rate. Before COVID, everybody knew what happened in healthcare. You'd go in, you'd have access to your provider, you'd get one-on-one care as an ER nurse. I got all that fun stuff. Everybody would, we'd have that one-to-one relationship. Patient safety was, at best, mediocre. During COVID, we all remember those horrific pictures, right? And I'm sure it affected some of us in terrible ways, but I'm sure it affected all of us in some way. We had an overflow of sick and dying patients. Capacity was reached. Big impact on hospitals and the readiness. We weren't prepared for it. But now, with telehealth and connectivity, now we're in a better position. Providing healthcare was very difficult, right? We couldn't access patients. Well, what did we at SEBA decided, how can we help? How can we take our technology and what can we do to improve outcomes of patients? We know COVID's going to be COVID. We can't do that, but we can certainly take these providers and take them out of a situation where they may be going into the ICU and having to gown up and putting themselves at risk when we already know there's a shortage of providers to take care of the influx of patients. So what did we do? We created a telehealth technology that allowed doctors, nurses, respiratory therapists to all see visually into the ICU remotely. So the doctor can be safe at home. The nurse, you're still going to need boots on the ground, but you don't need to put 10 people in an ICU room to take care of one patient. This is a picture that hits home to me. Obviously, you heard I was a firefighter and paramedic and all that stuff, but this hits home, right? This is obviously during COVID. The biggest thing that I will say here is the shortage in EMS staff as well as hospital personnel. I was telling the other speakers earlier tonight, or today when we were together, I haven't practiced clinically in a number of years, but I got multiple phone calls from recruiters offering me 5 figures a week to come back and be a nurse. Why? Because we had a shortage. We still have a shortage today, but it is not as exacerbated as it was by COVID. And one of the other things I'll touch on real quick on the EMS, because this goes to the use case that we now have with T-Mobile, is that firefighters, paramedics, EMTs, any public safety, they put their own personal feelings, their own personal apprehensions and fears aside to go out and take care of people. And they do it every single day. So if we have anybody in the room that is related to or is a first responder, I applaud you. All right. Let's get to the use case, right? Now we're going to talk a little bit about T-Mobile and SEBA and how we created this connected ambulance, as we call it. We'll start down here on the left. You can see Fire Department Ambulance 1. Well, actually, let me start at the top. You got a bunch of ambulances up at the top. Okay, now they get a 911 call comes in. The use case for this we're going to use is stroke. I'm sure it's affected most of the people in this room some way, in their family or something. We're going to use stroke. Clinically, we speak time is brain. So how do we fix this? Or how do we make access to care a little bit better? So we start with those ambulances up there. They get their 911 call. Down in the bottom, you see the ambulance there. You see them get off. Now, they get to the patient. They're evaluating the patient, the paramedic, the EMT, and they say, okay, we've got a stroke. What are we going to do with it? Well, what we're going to do is we're going to decide, I'm going to use this, it's got a multitude of, up on the screen, of different providers, but I'm going to use the neurology one just for this specific case. It can be utilized in any one of those ones you see up there. So what happens? The ambulance gets there, they evaluate the patient. They have T-Mobile's slashing connected ambulance set up on a tablet. What do? They get out of the ambulance, they go, they see the patient, they evaluate, they say, oh my, the patient's having a stroke, or I think it's a stroke. What am I going to do about it? I'm going to take that tablet, and I'm with the connectivity, and I'm going to connect virtually from the patient's home or the back of the ambulance to a neurologist. Where is that neurologist? They could be anywhere in the world. The specific use case we have is in New Jersey, and it's connected there. So they connect to an interventional neurologist as well as an ER physician. And now we have 2 doctors, 2 paramedics, and a patient all taking care of this patient. Why? What is the purpose? Remember I said earlier, time is brain. We want to evaluate the patient and determine, do we want to activate what we call code stroke? What that is we're going to set up the interventionalist. They're going to come into the hospital. They're going to be prepared, ready to take that patient. When they wheel through the door, they go straight to the CAT scanner. From there, they come back after the CAT scan has been read. They administer what's called TPA or thrombolytics to help break up this clot in the brain if they notice one is there. So we have actually taken and expedited this process. And one of the other cool things that we've done over here is we have taken this and made it a continuum. What does that mean? When the patient is coming to the hospital, we use our platform, T-Mobile's technology, as well as ours, to pre-admit the patient to the hospital prior to their arrival. That's pretty cool because why? I can now get all my orders done prior to the patient wheeling through the door, pending the outcome of the CAT scan. So, and for us, the new standard is a hybrid care model for the continuum of care. We can't be pigeonholed. We have to be able to expand our horizons, right? Let's be proactive, not just reactive. The last part is we connect all of those departments within the hospital back to these providers. So it's a full circle through, and these are just some specialties that we also deal with different use cases. And all the way at the top is the screens that the providers see when they are at the hospital and they're looking at them. And we use a mobile application, so the interventionalist, the neurologist, actually could be there and virtually while he's sitting in his bed at home to be able to provide care. I'm going to move on. This is what the ambulance looks like. This is connected. There's the tablet in the corner. Up on the right is the connectivity. This is as simple as it gets, but it provides that care that's so desperately needed when it's needed. These are some of our devices. The speaker before me, Michael, mentioned about hospital at home. We have a device that connects the hospital and the home when patients are discharged. All of these boxes, that big one at the top that says eConnect, IOMT, Internet of Medical Things, that is the box that has over 1,000 drivers and devices already preloaded. So it's a plug and play and or Bluetooth or wireless connectivity. The other is for home, and the other one can be snapped onto the back of a ventilator and moved around the hospital. This is just a use case that we did. We use telehealth carts in the middle. There's our eConnect box. This is actually in a 10-bed ICU. There's our little one attached to a Philips vent, and then a portable cart. This is a command center on the left side of the screen. This is what hospitals look at from a centralized perspective. They want things centralized. They want to be able to monitor. They want to be able to watch. This is actually at the largest hospital in Europe. This is our ICU room that's set up. It's got everything that SEBA possibly can provide, from the physician speaking to another provider on the screen, to the cart, to the eConnect box, to, we call it an easy button, kind of the old days, right, of the red, was that Staples or whatever, button. You push it, it's an emergency button. We have an all-in-one cloud platform. We're hardware agnostic, so it's BYOD. The ability to expand infrastructure to other specialties, truly scalable within an enterprise. Last thing here I'm going to talk about is, this is a specific use case we did in New Orleans, 5 hospitals. We cover tele-ICU, pulmonology, and telenursing in the ICU and in the ER. We have multiple endpoints, including in-room units, which is what you'll see up there, and I'll play that video here, as well as mobile carts. And if I click that, this should play. There we go. So what you're seeing here is us actually training. That is an intensivist on that screen. This is an ICU room. We're actually training the staff on what to do when they need an emergency consult in the ICU from an intensivist. That is exactly what you're seeing there. That's the camera. That's a 30 PTZ, so we can zoom in and, well, kind of like they did there, zoom in and see the patient's eyes, the pupil size. And I am going to pause that. I want to thank everybody for your time tonight. I appreciate you listening, and have a great evening.
Thank you so much.
Thank you.
It's so cool seeing the ambulance use case. Like, it's so simple, but it's happening, finally.
Finally, it's happening. Thank you.
All right. On to our final speaker for the evening, someone with whom I've had the opportunity to do a little bit of work with here at 5G Hub, someone with a vision to improve healthcare all across the United States, not just in our city centers, Dr. Ryan James. Ryan is the co-founder and CEO of Doppel Technologies, with a mission to democratize healthcare by building the technology stack to facilitate telerobotic and autonomous procedures. He's got a background in computer science from the University of Washington, go Dogs, and a PhD in biomedical and health informatics he got his Bachelor of Computer Science from the University of Michigan and Informatics from the University of Washington. Apologies, go Dogs. He's also held impactful roles at Microsoft, building large-scale applications, and NVIDIA, where he's been working on advanced AI processing algorithms. So now he's putting it all together to revolutionize healthcare and provide access in non-urban communities. Give it up for Ryan.
Hey everyone, I'm super excited to be here. So the end of last year, I was sitting in the audience, and this was right around the time that we started thinking about working with T-Mobile, and I was like, I want to speak at one of these events, and finally, I'm here speaking, so I'm super excited for this opportunity. Thank you all for being here. I'm Ryan James, the CEO of Doppel Technologies, where we're democratizing access to healthcare everywhere. And we believe that no matter who you are or where you live, you deserve access to comprehensive, high-quality healthcare. But unfortunately, there are 5 billion people globally that lack access to diagnostic exams and interventional procedures. And in the US, there are roughly 60 million people who live in rural areas that are geographically isolated, and consequently these folks have higher mortality rates for all the top 10 causes of death, including heart disease, cancer, and stroke. Part of the problem is that we have a provider shortage, particularly in rural areas, which forces patients to travel long distances, receive care late, and too often not receive care at all. And with 37% of the active provider workforce nearing retirement, this problem is huge, and it's only getting worse. That's why we co-founded Doppel. We're a data and AI company democratizing access to diagnostic exams and interventional procedures so that everyone can live longer, healthier lives. And what's unique about Doppel is that we're a software platform that powers third-party hardware, such as medical robots. And with the medical robotics industry growing rapidly, and with more and more clinicians adopting AI, now is the perfect time for our solution. And so we went out to rural hospitals and we asked hospitals and providers just like, what do you need? What do you need the most? And unequivocally, they answered ultrasound. And so our first product is a smart ultrasound system that brings diagnostic imaging to rural hospitals.
There's a healthcare shortage in most service lines out there. For us to hire a sonographer full-time here would probably be unachievable.
There are rural communities scattered throughout Washington that can't attract the specialists to live there. And so patients in those communities receive care late or they don't receive care at all. As a result, those communities tend to have higher mortality rates.
We're a critical access hospital. We're fairly remote, don't have the abundance of services that a larger hospital would have. The majority of our cost is operational costs when it comes to employees. This is one of the reasons why we're trying to find good services like Doppel to help us out.
I'm the CEO of Doppel Technologies, and we're building a telerobotic ultrasound system to improve access to care for patients in underserved communities. We put technology in these hospitals that consists of a robotic arm holding an ultrasound probe, and then we enable a remote specialist to hold a controller that enables them to scan patients over a 5G network.
You don't need 24/7 sonography, but you do need a sonographer and ultrasound to help situations where patients have to travel long distances, and through robotics we can do that. So this to me is a perfect solution.
The connectivity in each of these hospitals could be a little different than another one. And so T-Mobile's 5G network is going to be massive for providing consistent connectivity regardless of what hospital we're in. The people here at the 5G hub are incredible. Everyone's been super helpful in helping us move in, to getting us the technologies that we need, to getting us unblocked. Having the capabilities to test over 5G and working with people who know the ins and outs of the technology has been super helpful. Our mission is equal access to healthcare, and it's not just with ultrasound. Ultrasound is just where we're starting. We want to eventually be able to perform every single procedure so that people can have access to whatever they need on demand.
I think Doppel's a great solution, not only for us, but for a lot of rural America.
Thank you. Shout out to the T-Mobile team for recording that video. That was such an incredible experience for us. Also, I've never seen myself in such high resolution. It's just crazy to see. We've learned so much over the last, I would say, 8-9 months being here. We're in the back, and if you'd like a demo of our system, would love to show you. Two of the things that I'll just talk about quickly are that it takes about 20 megabits per second to support our system, which is about 2.5 megabytes per second, so not that much. And once we get to about 250 milliseconds latency, it starts to affect the remote expert's performance. And so both of these are well within the capabilities of 5G. We've done tests from here to Houston, here to Utah, California, and like it operated great. And so we're super excited about the potential for 5G, T-Mobile's 5G, to help us improve access in rural and underserved areas. There are a bunch of benefits of our system. One is just expanding the workforce through remote robotic and automated care delivery. Another is just convenient patient care. Instead of traveling long distances, patients can now go to their local community hospital to get the timely and comprehensive care that they need. In addition to, of course, increased profits for not only hospitals, and for rural hospitals is extremely important, but also health systems and medical device companies. Those medical device companies that couldn't sell to these hospitals before because there weren't specialists there, now can access a new blue ocean market. Ultrasounds are used to diagnose a whole host of diseases, which is why the market is $45.8 billion and growing. Our target remote robotic market is a growing subset. And we have a strategy to capture 20%. And I'll just take you on a quick journey for how we got here. We went through some of the top accelerators in the world, including Techstars and MedTech Innovator. We are currently generating revenue through outreach ultrasound services, so I would not recommend anyone do this, but we hire sonographers and we pay for them to travel out to rural hospitals to perform in-person exams today. It's a really hard business to run with very small margins, which is why pretty much nobody does this. But we've learned an incredible amount from this about our customers and our business model and who we're serving. And that's been extraordinary. We've developed a functional prototype, which again, I can demo to anyone who's interested. And we've created a quality system. We just got IRB approval to use this on healthy volunteers. So if anyone would like to be in a study, you're more than welcome. I think Austin just volunteered. We've won a few pitch competitions, including Seattle Angel Conference and Flywheel and DreamWord Event Fund, which are all Washington-based. And we've partnered with some extraordinary folks, including T-Mobile. My co-founders are incredible. We're serial founders. We've been working on this for quite a long time. Started off in research. My background, as Austin mentioned, is in computer science. Used to work at Microsoft, then worked on AI at NVIDIA, and did a PhD at University of Washington in health informatics. And that's where I met Dr. Sessler and Dr. Monsky. They're both Harvard-trained physicians. They understand the problem we're solving firsthand because all their patients travel to them. And so they wanted to figure out a way to increase access for the people that they care for. And so Dr. Sessler leads all of our commercialization efforts. He's built up our outreach ultrasound services and all the relationships we have with hospitals. And Dr. Monsky leads our regulatory affairs. He just got us back our pre-sub response from the FDA, and he's outlined our path to 510K clearance. We're going from prototype to production. And then we're expecting FDA clearance next year, and shortly after that, we'll roll out to those 4 customers I mentioned. We'll flip them from in-person to remote robotic procedures and scale up from there. Super excited about the collaboration we have with T-Mobile and what we're able to do with 5G to improve access for people who need it the most. Thank you all for listening.
Congrats on the certification.
Oh, thank you.
I will be reaching out to that study. That's awesome. Okay, folks. Well, that's 4 of 4 speakers. It's time to move on to the panel section of our presentation. Again, now is the last opportunity to submit your questions. Use the QR codes on either side of the stage. And please join me in welcoming our speakers back onto stage, as well as our moderator, the lovely Erin Rainey, Senior Director of T-Mobile's Tech Experience 5G Hub. Welcome, folks.
Hello, good evening. Well, let's give another round of applause to our speakers and panelists. Incredible, I learned so much. And for those of you that have been coming to Speaker Series now for 2.5 years, you know that this is the second time we've had healthcare as a topic. It's that important. And for me, I think it's my favorite vertical when it comes to 5G. Not only does it bring great operational savings and efficiencies, and we heard about those opportunities through the presentations, but it truly can change lives. It's impactful. And I think, spending some time today with the panelists, having lunch together, it's clear to me that everybody here is truly passionate about what they do, and it just resonates. And so I'm going to kick things off with a little bit of a personal question for Ryan. First of all, I'm just so proud of you, and it's just so great to have you here and to be a part of our session tonight and to see how you guys have evolved at the 5G Hub. So congratulations for that.
Thank you.
But I want to give you the opportunity to share your story and what motivated you to create Doppel and to create this healthcare solution.
Thank you. So I grew up in Kalamazoo, Michigan, which is a city that had one of the highest black infant mortality rates in the nation at the time. And my dad, who's a OB-GYN, moved us there specifically to address that problem. And he did it by bringing care into black communities over about a 10-year period that resulted in Kalamazoo going from one of the worst in the nation to having one of the lowest black infant mortality rates in the nation. So from that experience, I learned that, it's not about what you look like. It's not about where you live or your gender or, anything else. It's about the systems in place that either do support you or do not. And we have the opportunity to rebuild the healthcare system to support everybody. And so that's my main motivation, and I love sharing my dad's story, so thank you for that opportunity.
Thanks for sharing. Yeah, I think we have the technology and we have the capabilities to do these things, and I think it's our job to go make it happen, and you're definitely inspiring all of us, so thank you, Ryan. So Scott and Mike, I'd love to hear from you when we talk about the impact it is having on patients and care providers. With the great solutions that you guys shared with us, that you guys are implementing with your companies, what's the response been? What's the feedback? What are the results that you're seeing?
Sure. So I would say from our perspective, the results are overwhelming. Patient outcomes are improving. Length of stays in hospitals are decreasing. Overall patient health is improving. And we're doing this at a time where there's not a lot of financial viability, right? There's not a lot of money circulating out there for this, unless it's coming from maybe a grant from the federal government. So we are seeing great outcomes. We are seeing great returns on patients experiencing technology, how it should be used to improve healthcare.
Awesome, wonderful. Mike?
We're really starting to see, first from the clinician point of view, when Boston Children's went live, which was end of June, the first things we noticed when we walked the floors with their nursing staff and their physicians were they were able to make calls and receive telemetry as they moved patients in and out of elevators into the basement. When they were walking up and down stairwells, nothing was dropped. Everything was operating properly. That shocked them. And that, I think, will have a significant effect on the patients. And as we continue to monitor the situation, we'll get more of that data. For the home side, that has yet to be started because the infrastructure has just been built. So we expect over the next 6 to 12 months the ability to transfer hospital operations largely to the homes when those programs are created and put into force. And then we should see the same sort of response. But it starts with the clinicians that we're seeing right away.
Right. True, maybe you can share what you're seeing when it comes to deploying these wireless solutions and what's resonating most with hospitals and patients.
Yeah, so as I pointed out earlier, 5G is still seen as an emerging technology. And the reason is it's not a technological problem to be solved, actually. The technology is there, the use cases are there. But sometimes it's about moving the hospitals through that journey. And the larger the hospital groups, the more set they are in their ways and thinking. But I think from that point onwards, actually, right, we're actually seeing that accelerate quite a bit. And I do think COVID-19 has obviously made a lot of these business models far more acceptable. Now, if we were talking about telehealth maybe 10 or 15 years back, actually, right, again, the technology was always there, but it wasn't such a prevalent model to the extent that you have so many startups coming and doing different things. And if I look at the number of startups that I interact in my current job, the majority of them have always a healthcare use case to be solved, actually, right? Which means that there's a lot of money being poured into this, and the majority of them are going to use the emerging technologies. Now, Gen AI, in a big way, has taken off, and if you look at any traditional Gen AI use case, it always involves, processing a lot of data sets and LLMs and machine learning on top of it. And when you start adding the complexity of having these devices which are moving all across a hospital environment, it very easily lends itself onto an edge use case using a traditional 5G, actually, right? And we're seeing more of that happening quickly. So I think the major uptake is going to be around the new facilities or new build. That is always your best way to start showcasing the emerging technologies and put AI and everything else. For the ones which are already traditional healthcare settings and technology has to be replaced, we are finding a way to sort of coexist within a traditional Wi-Fi environment, right? But I guess the point I would like to make is this is going to be a very different field in 5 to 10 years from now. So.
Yeah. One piece I want to add to that, because we run into this with all of our clients, is it's education. The networking departments, the telco departments of the IT department as a whole, they have the wrong perception of 5G because they have the wrong perception of cellular technology in general. They believe that, and I'm generalizing, but this is largely the case, they believe that cellular technology is residential, is sub-industrial, and then for that reason, 5G doesn't make sense to them. So we find that we have to take these engineers, these architects, these folks in these institutions, and literally teach them. We have to show them technically that they don't understand this technology and that it's actually superior to what they have now. And that does take a little while, but we figure once enough of these institutions, groups have that understanding, it's going to catch on like wildfire.
That's interesting. I mean, especially when you think about privacy and security, you're going to want a cellular 5G network versus your Wi-Fi, hands down. So that's interesting that there's still an education opportunity.
It's critical.
Wow.
Yeah.
We were also, I know, discussing over lunch a little bit about some of the challenges to get hospitals to adopt this new technology, whether it's process or justifying the business case. Maybe you can share some of the points and kind of what you guys are seeing and how we, I guess, as an ecosystem can help them, take that next step.
Sure. The first thing is there is a divide between the IT departments and the clinical staff. So that's where you have to pay some serious attention. The engineers and the folks within the IT department have a preconceived idea of how their technology should be, and they're not necessarily in touch with the use cases and some of the things that have been mentioned here. So one of the things that I think T-Mobile has allowed us to do is to bridge that gap between the clinical staff and the technical staff. To take, for example, although we're a relatively small firm, we have doctors and nurses and clinical staff on our payroll. So they act as the bridge. They communicate to the IT folks what the real needs and use cases are. At the same time, our engineering folks help the clinical staff to understand what the true limits are of existing technology like Wi-Fi and whatnot. So that we're seeing happen everywhere. And T-Mobile seems to be like right in the middle of it. Your engineering, your marketing procedures, your technical folks, John Saw's guys, all of these, they've been invaluable in getting this message out to the hospitals.
Oh, thank you. And I mean, Ryan, you guys, I think initially were testing on Wi-Fi. Maybe you can share what you learned and kind of the the differences.
Yeah, I think the biggest thing is just consistency.
Yeah.
Like, we can put our system in any hospital and know that we're on T-Mobile's network, and the confidence that brings with connectivity, and some of the implications it has on security, like you mentioned before, is going to be really important to us, especially as we're going to rural hospitals that are pretty distant from largely populated areas, and so the connectivity out there, the Wi-Fi connectivity may be different, and so working with one provider that we have confidence in, I think is going to be really important to improving access.
Yeah, I love it. Tarun and Mike, maybe you guys can share a little bit about with the Boston Children's, the feedback on that and how there's an opportunity to leverage some of that to share those learnings.
Sure. So Boston Children's, as most people know, is a leading hospital in children's care worldwide. They were upgrading and consolidating a number of their applications. They were moving to Epic, and they were also, as I said, consolidating a number of their clinical support operations. They have a CIO who is somewhat different from the rest of the CIOs that you see out there. Someone that's willing to take a little chance, try something new. That's another issue that kind of impedes this, is the unwillingness to change and try something new. But Boston Children's put this system in. It took about a year from design, negotiations, and construction. It came up fully live in June in parallel with their Epic deployment. Other hospitals are now traveling to Boston Children's, and they're talking with Boston Children's. They're interviewing them and so on. And that's how I think you make change in hospitals. It's not just a matter of selling to them individually as like all of us vendors here. You have to marshal them to speak to their peers. They are their best salesmen, and they are the ones that will force the change. So over the next 6 months or so, as we start to actually calculate what are the savings, what are the effects on patient outcomes, how much less pissed off the clinical staff is because they're less burdened. Those numbers will drive a lot of this.
And if I just had to add, actually, right, we see a lot of the lemming effect in healthcare organizations, right? So having a BCH is very pivotal because that's probably one of the use cases or case studies, actually, right, where we can really demonstrate the power of 5G. So what's happening to Mike's point is I've been working with some very large healthcare providers in the US, and they're all willing to actually travel and meet BCH. And BCH is very good in this regard, actually, where they're very transparent about sharing their experience. And that's actually helping us incubate a lot more ideas there. So,
Yeah, love it. Mike, you touched a little bit about really improving the care providers, and because we need more, right? And the numbers continue to go down, and how these solutions are going to make their jobs easier, and then that's going to help retain them. Can you elaborate a little bit on that?
Me or?
Yeah, okay. Both of you.
Well, you laid out the case perfectly. There needs to be not just technology, but procedures, services that allow, and Ryan has the same sort of piece in this, the ability to take experts wherever they live and connect them to actual clinical situations wherever they live. So I think you're going to see much more of that, and it's going to be driven by much of what you've heard up here. At the root of all of it is the technology and connectivity that you guys at T-Mobile produce. But then right on top of that are the software elements, the hardware elements, the workflow elements, the service offerings that are layered on top of that. And as more resources are used efficiently in a larger geographic area, you'll start to see healthcare improve. That's at least pretty how we see it.
I have to agree. You took the majority of what I was going to say.
I'm sorry.
No, that's fine. One thing as a clinician that we don't like is change. We don't like it. I don't like it, and I'm part of it. Why? Because it's something that we're used to, and now and we've been used to doing it this way. I've been used to starting an IV this way. I've been used to intubating a patient this way, whatever it is. And now you're telling me I have to do something different, or you're going to propose a new workflow change for me. Process, workflow. If we can get buy-in at the facility level from the, and I'm not saying from the boots on the ground, if you will, but from the strategic leadership of the facilities, you will have a greater adoption rate across the continuum of care. People that really have a desire to see outcomes improved aren't worried about the workflow change or how it's going to impact their staff, although they have to be, right? Because at the end of the day, the staff is the one doing this. So we talked about this at lunch. We don't want to have it negatively impact people, but we also don't want the negative impact to be conveyed onto the patients themselves.
If I can also add a piece that I think is useful for people to understand. So Boston Children's is a good example of this, and we are continuing this with about a dozen or so other institutions now. To get the administration to agree to a very expensive and complex network install, because T-Mobile not only provided just the connectivity, but they provided MDM services. They provided a whole range of software and management functions that really no other carrier was willing to do. And there's a cost for all of this. So one of the things that Pixel does is we run these assessments. We look at all of the various areas of the hospital that are related to how this care will operate. So we created for Boston Children's an offset, if you will, that says, in this case, and I can't share the dollars because it's private to them, but about 60 to 70% of the cost was shared by proving to them, if you do this, then this cost can go away. These elements can be copied into here, this procedure will, but that takes a lot of work. And I'm assuming your organization does the same sort of thing. You assess, you watch what they're doing, and then you propose a solution. That's at the core of deploying this.
Great, thank you. So I'm going to check in with Austin and see, I'm sure we had some great questions submitted during the presentations.
Yeah, some pretty topical ones. We'll start with, can you explain the key challenges and technical considerations in integrating diverse IoT or IoMT devices and data streams within a connected healthcare ecosystem, particularly regarding data interoperability, security, and real-time processing? Scott, you'd mentioned Seba's device with over 1,000 drivers in it. You don't just make that without a really good reason.
Yeah, so part of the reason that was created was we were hearing from people in healthcare and hospitals specifically on how challenging it was to take a Philips monitor and a Respironics vent and a ResMed CPAP and a different type of pump, and having to integrate that directly into one system. It just was not feasible. So what we decided to do was to create a device that was truly plug and play, our eConnect box. And that box is, like I said during my presentation, you can connect it remotely or Wi-Fi, you can plug and play. It can go over Bluetooth. It doesn't matter. But what it does when it grabs that data is it aggregates it, and then, like I said, takes and pushes it to the EMR. we decided that was important because that was the #1 barrier to entry that we were hearing from a connectivity and an interoperability perspective from hospitals. Not the financial aspect, but the burden of labor that it would take to actually perform those integrations.
Thank you. Austin?
Yeah. This is a question for Ryan, and I think it might have some applicability across all of you, but how do you make money overcoming that rural installations will have low usage due to low populations served? And that might extend out to other telehealth instances as well.
Yeah, we've spent a lot of time thinking about that because if the business model doesn't work, then our business doesn't work and we can't help people. So what's really interesting about this is that because everything's remote, you can sort of aggregate the population. And so now a single sonographer located in Seattle, for example, can perform exams on patients who are distributed throughout Washington. And when you aggregate all those patients, you actually have really high volumes. It's just in each hospital there is lesser volume than in an urban area. But just because this is a remote exam, you can aggregate them all, and then the business model works really well.
I would like to add, actually, one of the business cases that we are seeing is if there's a very large retailer like a Walmart or a CVS pharmacies, there's always space given, actually, right, for doing tests or actually having like a small remote facility. And this is stuff that we've been currently experimenting with, and we're trying to install HSI, high-speed internet for all of these places, actually, right? And I think that's probably one good place for even rural America, actually, right? Because everybody goes shopping, actually, right? And the larger the hub, you always have facilities for that. And I would love to actually work with you and see if there's a business case, actually, right, where we can go to one of the large retailers and potentially position something like this.
One of our dreams is to, when we think about this a little longer term, is to go into a CVS just like you just put your arm in a pressure cuff monitor, except you go in and you get an ultrasound exam, you get your diagnosis back almost immediately, and then you go take care of the issue if you have one. And so I would absolutely love to work on that with you. Thank you.
Brilliant. Another question, pretty general, but an interesting point at the end. Please suggest your ideas for remote diagnostics, patient monitoring, and treatments. In addition to improving patient outcomes, how will the new technologies reduce the cost of healthcare?
Mm-hmm. I can take a stab at some of that. I think exactly what you said, Ryan. It allows to take expensive, limited resources and spread them out over a lot of cases, which absolutely lowers the cost of providing the stuff to, the solutions. The same thing is true of the technology itself. As it's mass produced, the costs come down. Much of the development costs, and I think you can correct me if I'm inaccurate, Ryan, but development cost of a lot of these things with FDA approval and all of that is quite expensive. And if there's a way through mass marketing of remote patient monitoring, you're going to bring those costs far down. If you spread out the professional service side of it, the expertise, whatnot, then the unit cost of the encounter is automatically much lower. So that's simply, I think, the primary force that will drive the cost down.
I can probably add a personal story. So I'm a first-generation immigrant to the US, and just like every other first-generation immigrants, we all suffer from parental guilt, having one elderly parent living in a different country, actually, right? So for my mother, actually, right, she's got a heart problem. And one of the things that I was installing at the place was just to make sure that she has wearables that can give regular inputs. So for example, there's a weighing machine. She has obviously an Apple Watch just like everybody else, and a blood pressure machine, actually, right? So even if we are able to just measure the 4 vitals, I think it has on a regular basis I think the impact it has in terms of preventative care is pretty huge. And what I mean by that is instead of going for a doctor for a checkup once every 3 to 6 months, or only when things go really bad, if there are certain markers that you put on your wearables actually, right, which actually trigger these kind of notifications going back to your healthcare providers, that actually reduces the amount of, firstly, the cost, and you actually get better healthcare, right? Now just magnify that to a rural setting actually, right, where you're very far away from your primary healthcare provider, and then you can immediately think about the ramifications of having RPM or any of these monitoring technologies, right? So in my view, I think telehealth, RPM, these have been around for a long time, but it's just about mass adoption, and the market force is really pushing it in that direction, which is what is happening right now. So
I'm going to jump in. Oh, sorry.
Yeah.
I'll speak to the clinical piece.
Yeah.
So the technology is wonderful, right? Everybody's got an Apple Watch. Everybody's got these wearables. You have access to it, whether it's through Best Buy or whomever. The bigger piece, in my opinion, or a huge piece, in my opinion, is the follow-up, the chronic care management for these patients who are wearing the wearables, like your mother. If a nurse or some clinician doesn't follow up with your mother to make sure that her A1C is fine and that she's not gaining weight and her blood pressure is all good, then as much technology as we want to have will not have any value or benefit to the patient themselves, because you still have the clinical component. So RPM and what we call CCM, or chronic care management, are essential to operate cohesively together. Sorry.
Okay, Ryan.
I was just going to comment on what you said. So we've been sending sonographers out to rural hospitals to perform scans, as I mentioned. And some of the stories we've heard, one of the craziest ones was there was a patient who had been waiting for 6 months to get a echocardiogram or a heart ultrasound. And it's just like, what's going to happen to folks who can't get diagnosed for issues that they have? You know, they could have a heart attack, or you know, something horrible could happen. And then if you just like for a second think about that from an economic perspective, it just gets more expensive to manage the care after that. But if we had been able to provide them access to care earlier, we could have diagnosed that a lot earlier, fixed it, and then the cost of care long term could have gone down significantly. And so, just to the point you were making, yeah.
And I just want to add, actually, right, even for hospitals, they would prefer if patients actually stayed in the hospital for a lesser amount of time.
Yes.
Because that's more turnover, actually, right? And optimizes the whole operations. And, making sure that preventative care is given, actually, right, is one step in that direction. So.
And as one last point I'll throw in, as financially, from a chronic care management and an RPM perspective, if you're in healthcare, you know, if a patient is discharged and readmitted within 30 days with the same diagnosis they were admitted the first time, guess what? Nobody gets paid. There's the economic piece to it. So chronic care management and remote patient monitoring are essential for chronically ill patients.
All right, it looks like we're over time, but I'm going to ask one last question for the four of you. I'm going to start with you, Ryan. Actually, one that got submitted here was, what's the estimated timeline for truly remote robotic surgeries? I'd be curious to get your perspective on that. And then we'd like to hear from the rest of you, too, kind of what's next? What's the future, when we look ahead?
Yeah, so it depends on, there's a few different ways I could answer that question. There was actually a remote laparoscopic surgery company that commercialized in Canada a while ago. And then there have been a bunch of demonstrations. I actually met my two co-founders during my PhD, and we did a minimally invasive heart procedure telerobotically. between Chicago and Seattle. And so there's no doubt that the technology's there. This is possible for sure. I think it's all about adoption and making sure we're addressing the right problems at the right time. And so, tough question to put an exact date to it, but it's absolutely the next evolution in telehealth, and it's here, and more is coming, and so I'd say soon.
Yeah, awesome. Yes, please, sir.
2 cents on it, actually, right? It just feels a bit like driverless cars. Technology is always there, actually, right? But if it's mass adoption, is all about regulation. And are you going to be fully comfortable by sitting in a car which is completely, driverless? Will I be comfortable having a robotic surgery with somebody performing this like hundreds of miles away? But you never know, actually. Ryan might just be the next Elon Musk of remote robotic surgery, actually. When I get there, so.
The new Da Vinci.
I'd put a timeline on it, actually.
Non-invasive ultrasound. We're not
crossing that.
You're going to get us there. You're going to get us there.
Actually, you mentioned Da Vinci. For those, I assume most of you know Da Vinci robotic surgery systems. They're kind of like the spider-like thing that's over the patient, and then there's this like console with the physician with his head in there and his hands and these actuators. While they're not allowed to do surgery fully remotely, what they are experimenting with now is training. So you can have surgeon A in the room inside the device controlling the patient, but in that city, another physician can be in another device who's learning. Obviously can't cause anything to happen, but what a great way to train and familiarize doctors that may not have the skills or the examples to learn from. This technology will do that. So I think you're going to see some of the more invasive stuff start out as training remotely, and then as regulation and laws allow, become actual.
Scott, what's next? What are your thoughts?
My thoughts are, we're going to find a way to connect everybody. We're going to find a way to connect healthcare. However hard it becomes, however challenging it becomes, I think we're going to find a way. And honestly, I think it's coming within the next 3 to 5 years. If you follow the pattern of what we've done over the last 5 to 10 years, I think in the next 3 to 5, we have a way to take care from pre-hospital, hospital, post-discharge, all the way up to the skilled nursing facility or assisted living facility that patients reside in. That's my forecast.
Love it. I think that's
Wholeheartedly agree. Yeah, that's exactly where I think it's going.
awesome. Well, perfect.
Don't hold me to it, though.
Okay.
Don't bet anything on it. Don't bet the farm.
Don't bet the farm. Awesome. Well, a perfect way to end. Let's give our panelists a round of applause. And we can continue the conversations. The bar is open. There's some amazing demos again on the back there, so please stick around and check them out. And thanks again. Have a great evening.